your EKG, your whatever, your vitals. So the nurses or the MAs will bring you back here first to the triage room. And then you would move forward into the exam room. So we weigh you, blood pressure, all that stuff here. Are real photos of that were taken by a photographer hired by Brenda Ryder, so they're unique and they're specific to the population that we're serving. One other thing that we really thought of, which we're going to talk about, are the curtains. And so again, they, we kind of try to make it to where they're comfortable and it's their environment. Some of the pictures and some of the door hangings and things like that are all along the line of barricades. So we try to keep the theme all set. So again, the standard exam runs down this way. This is really where medical assistants are. We have 3 medical assistants that sit back here, and then your patient would be, such as being, having your blood drawn here and etc. So that's the back.
Get the results like right away then.
Right. Yeah, usually if it's a blood draw, it's within 24 to 48 hours or sooner, depending on if there's something critical that came out. But anything that we do here on site, we give within minutes. Yeah, and we give flu vaccines, pregnancy tests, we give condoms. So we have a lot of stuff that we do extra than just a regular clinic. We give diabetic testing and supplies. So if you're diabetic, you're going to get a monitor, you're going to get your test strips, everything you need to maintain your healthy blood sugar.
I'm just curious, like if someone has a worker in the field, if they need to become pregnant, do you guys have services for them?
We connect them with services. We have what's called patient care coordinators in all of our clinics, and they really bridge the gap because sometimes the employees will only have the clinic. They won't have any other access to medical care outside of the clinic. If they're harvesters, they may not be eligible for the extra insurance. So we bridge the gap with the County of Ventura, different services, different doctors' offices that we've established relationships with. But once they're pregnant, that's really a more specialty care. So that's when we have to refer them out. But we do
Identity and empowerment.
them to the right
Identity and empowerment and Chicano.
cost-effective avenues that we refer to. And the county has a lot of programs for pregnancy, so they're pretty well taken care of about that area.
So here they go. So we're going to do this virtual introduction to the doctor. His name's Dr. Lopez, and this is the students, Dr. Lopez. And he just wanted to tell you a little bit more about the clinic, but he's in Santa Maria, so he's going to tell you just a little bit about his role. Go for it.
All right, cool. Hey guys, how are you?
Good thing you have
Hey.
Can you guys hear me okay?
Yes.
Yeah, I wasn't sure about doing this with FaceTime because I heard FaceTime can make you look like 10 pounds heavier and bald. It doesn't look like that, is it?
No. I don't think
No, it's funny.
Anyway, thank you so much for coming. So just so you all know, this was the first privately funded clinic for farm workers in this country that we know of. The first in this country. In other words, we're not affiliated with the county government, the state government, or the federal government. First funded primarily for farm workers and their dependents. And we basically work for those farm workers, right? They work for right above those affiliated companies. So one thing I want to remember is that for you guys to remember is next time you get to Costco or Whole Foods, this is who we work for. Okay, the people that do this work right here. Okay, so what we do basically, it's the first primary care clinic, as I mentioned, right? So what we try to do is see folks for a variety of things. So what I want you guys to see behind me is we have a cabinet full of medications. So all the clinics have the same amount of medications. Basically, it's about 100 medications. Tanya, I'm sure, mentioned the fact that we basically see people for the main conditions we see folks, which is diabetes, hypertension, obesity, elevated lipids. We saw someone for wound care. We also do some birth control counseling. We're basically there to help them get through the system, the healthcare system. As you all know, when it comes to healthcare literacy, challenging thing to try to work with folks. And so we do the best we can with trying to prepare them and let them know what's going on with their labs, what's going on with their symptoms. When someone comes in and say, farmer today, they'll say, I have dizziness, say a female. Well, when they come in, we'll check whether they have anemia, whether they're pregnant, maybe they have a urinary tract infection, maybe they have diabetes. So many times in healthcare, we want to tell people, hey, this is what you may have, but we also want to tell them what they don't have. Does that make sense?
Yeah.
Okay, so if you have any questions, please interrupt me anytime, and if I'm speaking too fast, please slow me down. Anyway, so when someone comes in, as an example, say a physical exam, they'll come in, I saw someone today, right? 35-year-old male, no significant past medical history. We will basically check their cholesterol levels, we'll check their liver, their kidney function, see if there's diabetes. Those are the kinds of things we're going to be looking for, and then answer any questions they might have. So that's for the most part. For a female, we'll also do pap smears, we will do mammograms free of charge. Preventative care is absolutely free of charge at the clinic. One of the challenges, I come from the public health area. I used to work at Las Islas Medical Group, and I trained at the County of Ventura. Number one residency in the country. Family practice. One of the frustrations as a physician is that I would give somebody a prescription for, say, metformin, which is for diabetes. Okay? I give them a prescription for glimepiride, for their sugar. I give them something for cholesterol. I give a prescription for something for their blood pressure. And they come back in a month, and I would ask them, okay, so how did it go? The reality is that, do I buy the medication, do I pay the rent, or do I buy milk? And this environment, and this thing, what we're able to do, we're able to give them medications for a $5 cost, which is amazing. When we talk about prevention, that really is key. Does that make sense so far?
Yes.
And so what we want to do is, we want to also, we don't really follow the idea that much about cultural competency or cultural proficiency. Why? Because that connotes you passed the test, and now you're there. Now you're a certified Latino, which we know is not real. We really talk about treating people with cultural humility, which we know that my experience as a Mexicano or a Latino is different than Gracie, who's our medical assistant here in Santa Maria, or Maria, who's also a medical assistant. Their experience is different than my experience. So the whole point is to try to really get to know people, get to make sure that we're connecting with them in a way that helps them get through the system. And hopefully, if they do have some sort of chronic disease, help them manage it better. And that's why the connection with Semana Salud is such an awesome kind of experience, because they get to hear what we have to say, and they also hear it from somebody else. Because food insecurity is something we all have to deal with. Does that make sense so far?
Yes.
Definitely.
Okay, and so like I said, we treat folks for infections if they have them. We also, the reality I tell folks is this, is that we know that medical science tells us, well, you have some sniffles, it could be a virus, let's give it some time. Well, those farm workers out there, there's no sick pay. You don't work today, guess what? You don't get paid. So the reality is we do as much as we can for them today, because that's the most important thing. We work for them. Does that make sense? I mean, I hope it's making sense. Once again, I want to make sure I emphasize that we're saying it, we do it in a way that is not patronizing. Does that make sense? It's not like Big Brother that we know better than them. It's about helping them.
2 minutes. Okay, 1 minute.
Okay, well, you guys let me know if there's any questions. I mean, this was amazing.
Yeah, let's do questions. Let's do questions.
Okay.
Questions for Dr. Lopez?
So the patients don't pay anything?
They,
The $5
you wanna
copay,
answer
just
that?
the copay, right? And then who pays for
They pay a $5 copay if they're in for episodic care or they're here for medications.
And
The
who
most they
pays
will
for
ever
those?
pay is $5. $0 if it's preventative care, meaning if they come in for a physical exam. Does
so,
that make sense?
yeah,
In
so
the
the,
clinic, but they also, mammograms are also covered, x-rays are covered if you have only the clinic plan. They also have the opportunity, if they'd like to sign up for added insurance coverage, say like a PPO plan or a plan with a specialist. Does that make
that would
sense?
be extra. Yeah.
Which
Yeah.
I don't know what the fee is for that.
Right, but everything's paid for by writer, right? So the
Rider
company,
and the employees
Yeah.
pay for everything. We are not
So is-
subsidized at all.
Is there a monthly fee that's getting revoked from their check every month? No, so it's not like a
No.
regular insurance?
They come in and once they come in and, it's not preventative care, then they have the $5 copay, and that's it.
That's nice.
Right, so yeah, exactly, that's, that's, in other words, the moment you work for the company, then you're entitled to come to the clinic. Does that make sense? But if you have to see a specialist, it's a different fee, but you're entitled to come in and get as much as we can, able to receive the care we give them for $5 at the most.
All right. Okay. So we're gonna call you again with a different group of students, okay?
Okay, any other questions, guys? Please, if you have any questions, ask Priscilla, and I can answer next time around. Thank you so much.
Thank you so much. Thank you.
So it's not like they have